Hello, everyone. Welcome. My name is Natalie Bull. I'm Executive Director of the National Trust for Canada. Welcome to this gathering of the heritage sector. Today, we're going to focus on reopening heritage sites. We've got a number of great heritage leaders here to share their experiences and to field questions from people calling in. So we'll just give it a few minutes as people dial in and get set up for the session. Why don't you go ahead and send us a note in the chat box to let us know what site you're representing or where you're calling in from. We really want this to be a great interactive session, so we'll be monitoring the chat box and the Q&A through the course of this conversation. And we're going to be presenting in English today, but on encourage des questions dans la langue de votre choix, and we'll do our best to respond to questions in English and en français. So welcome to those of you who are letting us know that you're in. I think we've already got almost 100 people listening in to this session. We've been doing these gatherings since early April, and we heard, I think, at our very first gathering about the issues that charities and historic sites open to the public and historic places of faith were facing as we started to grapple around the issue of closures, event cancellations, lost revenue, and the uncertainty around what the summer would look like for historic places. So we've been curating these conversations and bringing panelists together, and we've talked about a number of topics over the course of the summer. Let's move to the next slide. I just wanted to thank ARO, Annapolis Investments in Rural Opportunity, for sponsoring this particular conversation. Jane Nicholson from ARO got in touch to express her concern about the impact on the economy of so many historic places that would not be open to the public and the questions that they're all facing. So I think this is a really important and timely topic. The National Trust for Canada, as a national charity, we take our role as a leader of the sector seriously. We've done a lot of work over this past summer to bring these conversations together to help grapple with this unusual time. One of the events that we normally run in the summer, we were heading into our 4th year of Canada Historic Places Day. You can move to the next slide. So normally it's a one-day event where we bring a lot of national attention to historic places. It's about marketing and promoting historic places and engaging Canadians across the country and celebrating and appreciating them. We knew quite soon that Historic Places Day would look very different this year, and we were pleased with the enthusiasm that our partner Parks Canada showed in helping us reimagine Historic Places Day as an event that would run all summer long and that would be as much about digital and online experiences and social media celebration of historic places as it is about actual visiting. And so I'm going to ask my colleague Sonia Krutwagen, who is the National Trust lead on Historic Places Day, just to say a little bit about what's happening with Historic Places Day now as we're almost at the midpoint of the summer. Sonia.
Thank you, Natalie. Yes, so can you hear me? I am the Manager of Marketing and Digital Strategies here at the National Trust for Canada. And as Natalie was saying, we had to do a big pivot for Historic Places Day this year, and we were able to extend the timeline to be for July and August. So we're halfway through. And if you want to see what happened in July, it was a selfie contest where you could take digital selfies through our website. There was a huge engagement actually for the program. So if you look on Instagram, Twitter, and Facebook, with the hashtag Historic Places Day, you'll see lots of creative selfies. It's been really fun. And what we're launching soon, early August, is something called Visit List. So it's a way for Canadians and historic places alike to create lists with themes so people can go and visit these and follow the story of visiting these places on the website itself, and hopefully some now, some in the future actually visit these places in person. This new feature comes with a contest, so it's $250 for Canadians who enter, weekly draw for the month of August, and there's a $5,000 prize pack worth $5,000 for historic places that are participating. It's a marketing package that'll include consulting, photography, and virtual reality services. So we hope everybody takes us up on that. It should be really fun. We've heard some feedback from historic places because it's very mixed this year, whether you're open or open for ticketed entries, or if you're not open at all, that people have found using this program actually quite helpful. We got some feedback from somebody in BC, in Hope, British Columbia, that they had 80 people who showed up for on a Saturday for a town that is only 109 people. So they are quite grateful for the event going on, and we love to hear those stories. So if you have stories like that, please send them in. I'll pass it back to Natalie.
Great, thank you very much, Sonia. And so we're excited about creating all of this online and digital excitement around historic places to keep them in the hearts and minds of Canadians through the summer. But we also know that that it is also about the actual places, and that many of them are open to the public. In fact, it was my pleasure to be part of the launch of Historic Places Day on July 4th at King's Landing Historical Settlement in New Brunswick. And it was really interesting to see how that site has really embraced the requirements to create a safe experience for visitors at that great historic site. And I think that's really where the idea for this conversation came about, in speaking with their CEO, Mary Baruth, who is one of our guest panelists today. So over the last few months, we've had lots of questions from historic sites and from places of faith, with questions about how to keep visitors safe, and also how to keep their historic places and those historic finishes safe as well. So we know that some sites are choosing not to open for technical and safety reasons. Others are opening successfully. So at this session, we have three great panelists: Mary Baruth, the CEO of King's Landing in New Brunswick; Janet Kepkevich, who is a specialist in heritage interiors at the Canadian Conservation Institute; and Kendra Fry, who is General Manager of Trinity St. Paul's Centre for Faith, Justice and the Arts. And I'll introduce them with a little bit more information as they begin to speak. We also have Chris Weeb on the panel here from the National Trust, who will be monitoring the questions and the chat box. So send those questions in, we'll be watching for them. And just a note that we will also be sharing a recording and the chat record of this webinar within 24 hours after the end of the session, so you can watch for that. And just a caveat, I think that we're not offering specific advice for you or your historic site. This is really intended to be offering resources and experiences from people who are looking very carefully at the requirements. We do know that every province is in a slightly different place with regard to opening. So just that little caveat there as we get going. So why don't we start with Janet Kepkevich. Janet has over 20 years experience in the management and preservation of cultural resources. She's been at the Canadian Conservation Institute, a great institution based in Ottawa, since 2015. She's a senior collections management advisor and provides guidance in the life cycle management of heritage assets and built heritage components. And she'll talk with us about the task force that CCI has been a part of and the work that they've done to provide great advice to historic sites and heritage organizations. Janet, over to you.
Thanks very much, Natalie. In April of this year, the Canadian Conservation Institute's COVID-19 task force prepared a note to assist cultural organizations during this pandemic. The second edition of the note, Caring for Heritage Collections During COVID-19 Pandemic, is slated to be online Friday, July 31st. Since the first note appeared in April, we have revised the second note based on new data, provided additional details to existing sections, and included information on reopening and the challenges for historic home museums and heritage buildings. You can find the April 17 release note on CCI's webpage. You can find the April 17 release note on CCI's webpage, as well as links to the two webinars presented by Irene Karsten and Tom Strang. To begin, I will touch briefly on a few aspects of the virus. I will then discuss reopening for historic homes and heritage buildings, focusing on alternative solutions. Heritage professionals are coping with many challenges brought about by the COVID-19 pandemic. While collections are not directly at risk, the pandemic complicates their care. Public health agencies agree that COVID-19 virus is primarily spread from person to person via an airborne path when an infected person sneezes, coughs, or speaks. According to the World Health Organization, people can catch COVID-19 by touching contaminated surfaces or objects, and then touching their eyes, nose, or mouth with unwashed hands. If an infected person coughs, sneezes, or speaks in the direction of, or handles collection objects with contaminated hands, the object materials could be contaminated with the virus, which could, in theory, be transmitted to those who handle the objects afterwards. Since collection objects tend to be handled infrequently and the virus deactivates naturally outside the human body, the chance of transmission is probably low. The risk may be higher where people work in heritage interiors because the likelihood of different people touching an historic surface in quick succession is higher. Information on the stability of COVID-19 virus has been published in 2 laboratory studies. It is important to stress that these studies aimed to inform operation of critical healthcare systems. This means that the materials and test conditions primarily model the functions and surfaces found in hospitals. Persistence does vary with characteristics of the surface material and the presence of other contaminants. The virus tends to persist longer and to transfer more easily from smooth surfaces like metal and hard plastics than from porous surfaces like paper and textile. After reviewing the latest information, an isolation period of 7 days to allow the virus to deactivate naturally is recommended to encompass the range of materials encountered in your collections. The revised note provides further detail on the persistence of the virus in the studies. I would like to add that while revising the second note, the REALM project, which stands for Reopening Archives, Libraries, and Museums, completed their second set of tests on the natural deactivation of the virus on various paper-based objects. Their testing is showing surface-dependent variation in viral persistence as seen in other research. CCI is following their progress with interest. The COVID-19 virus is still circulating in most communities, so many visitor activities and collections care are being modified to meet public health recommendations on reopening. One of the questions on the minds of many heritage professionals is whether disinfectants can be used on heritage interior finishes and fixtures. This is not recommended. The chance of damaging heritage materials is too great given the presence of such chemicals as bleaches, chlorine, alcohol, and other damaging additives, disinfecting solutions. The occasional use of an isopropanol solution on some heritage metal surfaces is acceptable, but may be damaging when used on a regular or daily application. Even increasing regular cleaning of high-touch surfaces will be a challenge for historic house museums and similar heritage buildings, since normal housekeeping practice limits cleaning to protect historic surfaces. Non-heritage surfaces, as well as washrooms and working kitchens, can be cleaned and disinfected regularly. Although the surface transfer is not the main way that COVID-19 virus spreads, limiting touching of heritage materials will reduce the likelihood of such transfer and protect heritage interiors at the same time. Untouched surfaces require less frequent cleaning. Each institution will have to determine what is possible at their site based on the characteristics of buildings and spaces open to the public. Having reviewed King's Landing's webpage and the reopening strategy, I see that they have implemented many of the recommendations you will find in CCI's revised note. I would like to present some of these options. Meeting certain public hygiene requirements for reopening will protect heritage interiors as well as staff and visitors. Some of the basic recommendations by public health authorities include the following. Ask that all staff and visitors wear non-medical masks to contain respiratory droplets. This is especially important in close contact settings with poor ventilation. Provide hand sanitizer in key locations, such as upon entry and exit and outside washrooms. Staircases with banisters are also ideal locations for hand sanitizer. Just remember, do not attach hand sanitizer dispensers to heritage interior finishes. Alternatively, and if available, provide all visitors with gloves as they enter to reduce the need to clean certain heritage elements, such as banisters. If using cotton gloves, a receptacle for used gloves should be placed at the exit so that gloves can be laundered daily for reuse. A phased reopening approach and controlling access and touch points throughout the building and premises will aid in protecting the public and heritage materials. Consider the following. Keep doors open along the visitor route where possible to minimize touching of door handles. Ensure that doors are closed at the end of each day as a fire protection measure. Add or modify the placement of stanchions or other barriers to limit access or areas to areas or to prevent leaning or holding onto heritage elements. Rotate access to heritage spaces on a weekly schedule to give the virus time to deactivate naturally should contamination have occurred. This might be particularly applicable to historic sites with multiple heritage buildings. Provide virtual tours of temporary closed areas that visitors can view on their smartphones or on home computers after the visit. One of the key elements in protecting staff and the public is to maintain physical distancing, but this can be a challenge in historic homes. Consider these options. Mark non-heritage floor runners to suggest visitor spacing. Runners of different types or colors can be used to establish a single visitor path through a heritage building. Bear in mind that long-term use of certain runners is not recommended. Alternatively, consider adding stanchions at 2-meter distances and attaching directional signage. Attach ribbons or other fabric material at appropriate intervals on stair banisters to indicate physical distancing. Control entry to spaces that have only one entry and exit route to a single group at a time. If this is not feasible, consider blocking access until the pandemic risk is lower. Integrate outdoor spaces into the visitor experience by providing interpretation or activities that can help pace visits while benefiting from the lower risk outdoor settings. Visitors who know what to expect in advance are less likely to be disappointed or concerned by the temporary measures adopted to safeguard people while protecting heritage interiors. Finally, for the organizations in which heritage furniture and other objects are in daily use, balancing the need of the public safety with preserving heritage is a challenge. Hard decisions have to be made. All decisions regarding the use of the collection and interior fixtures should be documented, and a scheduled review or reevaluation on the cleaning protocol and the condition of the material take place. Where possible, consider substituting less important pieces in areas where the disinfecting is necessary. Rotate the spaces in which regular use or planned functions occur and allow sufficient time for the virus to deactivate naturally should contamination occur. Identify those pieces or spaces with greater significance that represent the organization and its mandate, and strive to have them protected over other objects, furniture, or spaces. Reflect on your emergency protocol. Have you identified elements and spaces within the building or property that are paramount to save in a disaster? This may help your decision-making process, although it is not an easy task. In summary, protect people first. Upon reopening, follow the advice of public health authorities, but be prepared to close your institution whenever the pandemic risk in your community is high. Prevent contamination of heritage materials through use of masks, hand sanitizer, gloves, controlled access, and physical care of items of greatest value. Surfaces that are not contaminated do not need to be cleaned or disinfected. When contamination of heritage material does occur, use isolation to deal with it. The virus will deactivate naturally within 7 days. Disinfecting solutions, however, will damage many heritage materials. Find heritage solutions in protecting the public, historic home museums, and heritage interiors. I wish to acknowledge my colleagues in the CCI COVID-19 task force and the extra contributors for their expertise. I would also like to take this opportunity to thank the National Trust for inviting me to participate in this discussion. And just as a final note, I would like to add that I am not a doctor, I am not a scientist, I am not a virologist. However, as many, we do rely on all the material and evidence that is coming forth from the WHO, from the CDC, from Health Canada. So this discussion is based on that information. Thank you very much.
Great, thank you very much, Janet. So really, it's a complex topic, lots of things to consider. You've given us some really good practical advice that I think sites can consider as they map out their reopening strategies. And I think your presentation is a great segue now to hear directly from Mary Baruth, to hear about how she's implemented these kinds of measures at King's Landing Historical Settlement in New Brunswick. And just a word about Mary. She's worked in the field of heritage and cultural management and community development for more than 33 years. And she comes to New Brunswick having worked at sites in Ontario, most recently the Jack Miner Migratory Bird Sanctuary and Foundation in Kingsville. And she arrived to this new role as CEO at King's Landing at a moment when the whole world changed around us. So Mary's done an amazing job in responding to the pandemic and bringing lots of exciting ideas to King's Landing. So over to you, Mary. Thank you.
Good afternoon, everyone. I'd like to thank the Trust for the opportunity to speak to this issue today. And I appreciate, Janet, that you looked at us online. And you mentioned a key number of elements. We wanted to make sure that people, before they got here, knew what they could expect. We ended up opening 10 days earlier than just so that we could. We wanted to prove that we were able to. So these were some of the things that you'll see, some photographs that have come up. And one of the things that we did was, it was made very clear early on, I think, to just about everyone, that in order to open, we would all have to have an operational plan. And given that all my staff was at home, we asked everyone to present their ideas. But the key to the success of our operational plan was that we undertook it from the point of the visitor. So I drove my truck into the parking lot and I walked into our site to make sure that all the places, to see where there would be opportunity to give instruction, to make people feel comfortable. And we were all committed to making people comfortable and to treat them with kindness, but also keep in mind the Government of New Brunswick's COVID protocol, the CDC, Health Canada's protocols, as well as public health. So some of the things we did in advance, of course, was we kept the public involved and notified of any changes that we had. We did cancel some programs, but at some point along the line, we made the decision that we would embrace COVID, partially because, as Natalie mentioned, I arrived here 6 months ago. I was here in the site for 6 weeks before COVID hit, and that's one of the benefits of coming to a new area. I didn't know a whole lot of people, so COVID sort of became my life. And having to look at how we were going to reopen, because the one thing I didn't want to do was close King's Landing for this season. We were very fortunate. We had weekly meetings. As a Crown Corporation, we had weekly meetings with our contact there, to Arsenault, as well as Bill Hicks from the New Brunswick Museum. He was involved in those, and Brent Suddy in how we could kind of move forward. As a Crown Corporation, we followed what the province was dictating because they are the experts and we aren't. And we just made the decision that we'd fall in line and make sure that we made the best plan that we could. So we repositioned ourselves as an open air museum. And one of the things that we cite is that, you know, we are the originators of physical distancing. We have 300 acres, so 300 people can stand here and have their own acre to themselves. We did make it mandatory. The only thing that we've stayed mandatory is that you have to wear a mask when you go inside any one of our buildings. Our staff are prepared to address the issue if you come into a building and you don't have a mask. If you're not wearing a mask because you can't, you are identified by wearing a button, and the staff don't point you out. They just acknowledge that they don't acknowledge that you have a button on. They just know that they are to put their own masks on to make sure that they can maintain the physical distancing that's required. We put in barriers, but are friendly barriers. So the staff all were trained. They were brought in as casual staff, as they were brought in June and in May, so that we could go over what was going to make them feel most comfortable and what was going to make our visitors most comfortable while being safe, because that was our key to the whole process. One of the things that we did was I initially sent up a draft in April prior to the request for operational plans. I sent it to the province, and it got forwarded up, and it got our cultural organizations moved from phase 3 to phase 2 for opening. And we invited public health and safety here to take a look at the plan, to walk through the plan. I walked through it with them, and we were very successful. We did sympathetic, plexiglass was a high demand and very expensive. And so we used table vinyl, as you would for, some parents used to cover their couches in it. And we made frames, and we integrated historic windows at the ends of our admissions and retail and in other areas. And these are all able to be cleaned with the recommended cleaners, quat cleaners that are on the list for COVID compliant cleaners. Nothing clouds. As you can see in this one picture, if you're looking at this, Linda, who is behind the vinyl frame, she cannot wear a mask. So she wears a button to indicate that she can't wear a mask. And people understand that. We make it, all of our wagons have to have, you have to wear a mask when you're on our wagons. We created things that look like birdhouses throughout the property that have hand sanitizer that's automatically dispensing, so you don't have to push any buttons. So as many places as we can are hands-free, and all the ones that are touchable are wiped down right after use. We have janitors checking the washrooms every hour, cleaning. And so it's a full-time job. But the one thing that public health said about us is that we had embraced it. We hadn't pretended it's not there. You'll see some screens above where the admissions desk is. We have a number of video screens and in that admissions area, and we have constant signage to reinforce the message. And one of the most strong message so far that we've gotten from people is when they walk in the Welcome Center, you'll see an exhibit on the 1918 pandemic. And we have photographs of people with masks then, and we talk about that pandemic and why this is so much like that pandemic, and how we need to follow the same guidelines so that we don't end up in that situation where, we have wave after wave and so many people die. So people have been very positive. We've only had one person refuse to wear a mask, and we've had no one refuse email contact tracing, which is what's been recommended to us, because we can just copy and paste that into an email. If someone has become sick, we can just send emails out to let people know that somebody who had been at King's Landing on whatever date has come down with COVID, and we can, public health can then send a note out. So, we mentioned earlier with Janet that any common surfaces, most people they're still going into our buildings. We are wearing gloves when we serve food. It used to be that you used to be able to grab a cookie off a plate. We don't do that anymore. We use tongs, and our staff have gloves when handling food. But our feedback has been very positive. People feel at home, people feel safe. And that's what we were aiming for. We wanted everyone treated with kindness. We wanted people to still have the great King's Landing experience with a couple of changes. And our draft plan is now in draft, sections of it in draft 9. I'm working on draft 10. And our partners are all part of it as well. We have a partnership with the New Brunswick College of Craft and Design, and they are looking at redoing their workshops as well. So I'm glad to share our plan with anybody who's interested. I've shared it with our provincial parks. I've been on conference calls with living history sites in Nova Scotia as well as Ontario, and I'm certainly prepared to share it. It's it can certainly help. Might not be everything you need, but it'll certainly be a good starting point for everyone. And again, I'm not a doctor. I don't play one on TV. I'm simply somebody who, because of the nature of my position, I was flung into this and have been involved in a tourism panel from across Canada regarding the tourism aspects of the COVID implications and this. And Natalie, again, I really appreciate that you came out here on to kick off National Historic Places Day. It was great to have you out here, and I'm really pleased to have been invited to be part of it.
Great. Oh, thank you so much, Mary. It was great to see in real time what you're doing there at King's Landing, and I think it's a real opportunity for sites who are maybe welcoming or have the potential to welcome more local visitors.
Mhm.
The national and international tourism may be a bit slower, but it's a way to really reach out to people in your vicinity. And I certainly saw lots of local New Brunswickers visiting the site when I was there on July 4th. So
Thank-
I know there were some great comments, Mary. There are others who feel your pain of having the site just as the pandemic was hitting. So we'll have some conversation about that after all the speakers have had a few their opportunity to share their thoughts. And I know there are some questions that I had shared with Janet in advance that came in advance of this session. So we'll get to those as we once we've finished hearing from everyone. So that leaves us with Kendra to speak next. Kendra Fry is the manager of Trinity St. Paul's Center for Faith, Justice and the Arts in Toronto. She's been a big part of making that place a going concern, welcoming much more than just worshipers into that building in Toronto. She's an important player in the group of people who are grappling with the question of places of faith in our country, and she is also someone who creates hubs for the common good. So happy to have you with us here, Kendra, to talk a bit more specifically about advice for places of faith as they come to terms with reopening.
Great. Thanks, Natalie. Can everybody hear me okay? Chris, can you give me a thumbs up? Yeah. Okay, good. Hi, everyone. Thanks for joining us today. So as Natalie said, I'm with Trinity St. Paul's, and I also repurpose churches across Canada into hubs, working with all kinds of partners, including the National Trust for Canada. Trinity St. Paul's is a very different site than your average museum or historic site. It's a living historic site. So it's a 44,000 square foot historic church downtown Toronto, right at Bloor and Spadina. We have 14 resident companies, 400 user groups who use us on a weekly or a monthly basis, and we welcome 10,000 members of the public every month. So our question of reopening and a heritage space is much more about a site that is living constant use rather than preservation, which has been problematic and challenging. We're still in phase 2 here in Toronto, so we in fact are not yet open, but here are some things we've been talking about with all kinds of partners around churches and about how you reopen these large-scale church hubs. First of all, remember you're all doing your best. You're in difficult circumstances. We're not experts, you're not experts. We're all gathering the information that changes all of the time. Forgive yourself for the things you don't know, gather the information you can, and charge forward in whatever way seems best for your region after careful consideration. So, next slide. So when you're thinking about a church, you got to think about the scale of it. Are you a small Sunday only church? Under which case, just as mentioned by Mary and Jane, it may be that if you're only there every Sunday, you don't actually need to change your cleaning protocols at all. The nature of time will take care of any impacts that might be on that church. So the only protocol changes you'd be making then are in regards to your usage pattern when in the church, which we'll talk about in a second. But if you're a big community hub church, that's a different thing. You might see a lot of members of the public. You might, like us, have a daycare or a restaurant or a school or all the other kinds of things that we have that you are trying to keep safe. So for church services, while it's permitted in most regions already, they're risky due to the following factors: the large gathering size, the elder population, and the habits of food, drink, and greeting that really increase the risk for these user groups. So a large majority of churches have chosen not to open yet in Canada, even though they've been permitted to do so for, I think, 7 or so weeks now. User groups that may be allowed to gather earlier include daycares, and certainly that is being pushed quite heavily now, tenants of offices, smaller user groups, and in fact, you may have been continuing food banks and pastoral care all along, under which case you've been open this whole time and managing things as well as possible. Next slide. So think about your traffic flow. We talked a little bit about this in the other one, so I won't spend too long here. Is there a way to create one-way traffic flow? Can you do arrows that indicate directionality? Can you leave some doors open? Have you considered assigned seating for services? So we've gone to that. We sent out the seats that were going to be available versus the ones that were blocked off to the congregation. And when they return in mid-September, they will have to choose a seat and sit only in that seat. And they will have to choose a door that they come into to get to that seat, where we are gifted with 7 doors that could take you to that space. So you will be assigned a door. So for instance, North Tower, and then you'd be seating on North Sanctuary main floor. And then because we are also a recital hall, there is actually a number. So it would be D, 23, 24, 25, and those are divided into sections according to the scale of bubbles. We'll be doing a similar thing with our professional arts groups. So Taffel Music Baroque Orchestra is our largest user. Those will be, we're always assigned seating, but now our assigned seating with significant spacing in between that we have drawn out so that the seats that are not used are common between all of our user groups. So everyone who uses our sanctuary, which is 60 some groups, will have the same set of not utilized seats versus utilized seats. Bathrooms, should you only allow every other stall? Where should people line up? How do you want to manage that? What's the traffic flow? What's the airflow? So we have several bathrooms on the main floor that are 2 and 3 stall that have now become single stall for the time being. So next slide. Entry protocols. Yes, use hand sanitizer. Yes, wear masks in public spaces. Keep your distance and follow the directional arrows. We've had to close all of our kitchens, which was a tragedy of epic proportions, being a church with also that many users. People were not very happy, but that is what it is. Leave immediately upon their business being finished. So one of our major issues is the number of children who do things or people with high needs in our space, and they are usually have someone accompanying them, whether it's a parent or a nanny or a caregiver. All of those people now cannot hang out in the hallways like they used to. There's simply not enough space for them. So that's really changed our usage patterns. So now you're coming in on the north door, leaving your person, going out the south door and waiting in a covered garden area that we built in order to wait to pick up your person. Next slide. High touch points need to be cleaned more often. You guys probably have already all talked about this. Doorknobs, light switches. Is it time to install those automatic sensors so no one needs to touch those light switches? Bathrooms, we'll be cleaning them every 2 hours now instead of every 3 or 4, which is what it was. Do you need to change the way that you clean? Depending upon what your space is, can you do blue light sanitizing? Can you do misting sprays, disinfecting sprays? We are really struggling with our pews, which are extremely high touch and old wood, and I still actually don't have a solution. So I'd be happy to hear from others about solutions on how to sanitize wood that dries out. How will you ensure safe space in your room? So we're doing circles on the ground, removing seats, reducing the capacities of our room. We're also, for the time being, disallowing singing and playing music on wind instruments, as these are considered to be quite high risk at the moment. We'll see if they continue to be. Contact tracing and reporting, same as the other groups, only our difference is because of the large number of 12-step groups, that's all done anonymously. So each group does the contact tracing for their group. It goes in an envelope, the back gets signed, it gets dated, it gets registered with our front desk. We keep it for 3 weeks, then we shred it if we don't use it, but if we do use it, then it gets handed over to public health. So your anonymous nature of your interaction with the building is maintained all the time. Next slide. Okay, water systems. This is really complicated. Go to this site or the one in your region. It looks like most regions are doing their own version of this. If your building has been empty for several months, you need to do a full water flushing system protocol. And it's a little complicated, and I'm not going to describe it here, but do go and look at it because you need to flush all the way from your main line all the way out the building, as well as fully emptying your hot water tank before people return, and checking all the lines on all of your fountains. And this is what we're requiring people. So this is our new user group layout. This is what's going to our user groups. So they say that they will make sure that their groups are maintaining 6 feet of space, that they will have a sign-in as indicated, no more than the number of people that we indicate to them in each room, no members of the group lingering in the hallway, no food or drink served. And that is it on that. I know it sounds super intense, but it's what we need to do to keep the number of users in our space safe. Yeah, so Trinity St. Paul's values your safety, but it's a group effort to ensure safety from infection, and we cannot guarantee that our venue is free from infectious disease. And we're saying that if the requirements are not adhered to, then the booking will be canceled. So I think that's the last slide, and I'm sorry, that was a quick tour through, but a lot of it was the same as what had come before, and I want to leave time for questions and conversation.
Great, thank you very much, Kendra. Yes, it is intense, and it's a very important topic with lots for us to be conscious of. So thanks very much to all three panelists. I encourage you to talk among yourselves and ask questions. I'm sure we would all enjoy hearing what questions you have for each other. I might just jump in. I think Chris has got some questions lined up as well, but maybe Janet could respond to the question Kendra raised in her presentation about dealing with old cracked wood and how to sanitize those kinds of surfaces.
That is the big giant challenge, especially if it is already damaged wood, which is understandable considering it's used daily, and yeah, and it's, you know, some of it is going to be not in perfect condition. So washing on a regular basis, even if it's just going to be soap and water, but washing every day, that's going to take a toll on it. The same with any type of sanitizing. So, I mean, the only, you know, either you can maybe, if you're limiting how many people that are coming in, maybe it's again that rotating of certain cues that you can use this week and not that week to allow some of the natural deactivation, or at least to allow for not daily cleaning. So instead of cleaning all the pews, you're cleaning, you know, half the pews every other day or every third day. That's still not to say that that's a good idea, because it's not. You're probably going to have to monitor what's happening. But you may want to, you know, it's the big question. We want to bring people back in. So at what point does the effects of cleaning play on interpreting COVID-19 on our heritage assets? Does it become part of the story? And in 15 years, that can be a part of the story. Oh, this section was more damaged than anything else, and that's because of our practice that we used during COVID-19. I'm not saying that that's the way to go, because you don't want to be damaging things, but yeah, you've got a big issue, and you may want to consult like wood conservators to take a preliminary look at your pews and maybe come up with some sort of strategy.
Thank you, Janet.
Yeah.
I think there's been a general dismay amongst the conservators as well. Their opinion is the same as yours. This is going to suck, the end, is kind of the general feeling right now.
Well, what we're doing at King's Landing is we are doing exactly what Janet's suggested, that we have regular church services every Sunday in both of our churches, more regular at St. Mark's than in the Presbyterian Church. And we switch, we mark which pews you can sit in, where you can sit, so that we're not damaging, So this week you can sit in the back row. Next week you can't. And my favorite place is the back row, right? So we just make sure people move around so that we're not getting into that. But we're using the cleaning aspect as part of our story. That we have a whole bunch of OCD people who are from the 19th century who need to clean.
Mm-hmm. It's interesting. We had a comment from one of our participants. Kathy Dwyer says her plan is to make a vinyl removable tube that can be Velcroed on the banister, wiped down in place and removed at the end of the day, which I thought for banisters actually is a great idea. Thanks, Kathy.
Yeah. Yeah. So depending on, and actually that's a pretty good idea, especially because it's removable. You just want to make sure whatever you're using is not going to be a health hazard either. So you don't want anything really slippery or anything. So that works. Whatever you can come up and think of, I think that's great, especially if you can protect the wood. That's not to say that you can't. Well, even for your pews, I don't know if you want to cover them or cover certain sections of them with some type of cloth that then is washable. Again, that's an option. It's pretty intense, and if you have a lot of pews, then that's a lot of laundry that you're doing. The other thing too is that as new information comes out and about the virus, and especially about how it's transmitted, because we know that we're all wearing masks, or almost all of us are wearing masks, you know, maybe it is that surface, maybe the likelihood of touching a surface isn't going to be the end of us. So maybe we don't have to do as much cleaning, but we have to wait to find out what they say in the next coming weeks or months of all the testing. So there's a real discussion between a lot of the doctors and scientists. So I won't say any more about that. I did see something on the question on the chat line about alcohol, using alcohol-based hand sanitizers and using that just before you go up and down the staircase. Yeah, that's a potential issue, but as you quickly, the alcohol will quickly evaporate, and the effects are probably going to be very, very minimal. Having said that, there is a link to the Library of Congress did actually a test on the effects of hand sanitizers, both water-based hand sanitizers and alcohol-based hand sanitizers. We've got it on the we've got it in our CCI note, but I think I sent Rob a link to it as well. It might post it. But basically there, in understanding that test, they really saturated the material. So it's a bit different than saturating a material with hand sanitizer versus a very light touch every once in a while. So again, it's hard decisions.
Great, thanks, Janet. Chris, did you want to raise some questions from the chat box before you have to leave us?
Yeah, no, it's from the Q&A box. I was just wondering about the mask situation. There's a couple of questions here. One about how to handle that situation that Mary was talking about, where people can't wear masks and there's a special button for them to identify them. What does that look like? If you could provide a bit more detail on that. And also, I guess, there's the question of what do you do with visitors who refuse to wear masks for no legitimate reason? What's the how does one handle that? And some thoughts from the panel would be great.
Okay, so this is Mary. To respond to the first thing is, initially we thought we could wear stickers, but stickers fall off. We made buttons we bought a button maker and made a button, and it's just got the King's Landing logo on it. And we give it to people, and they feel like it's a souvenir, and they wear it proudly because it's a button. So it just, all the staff identifies that that's the button. And other visitors, we tell them that, you know, that if they can't wear a mask, they are given a button. Nobody knows what the button looks like until they get here, so that nobody can make copies of it. But people take it home and they ask if they can make a donation back towards us, the button, because it looks like a souvenir. The same thing with the masks. We have a lot of people who arrive here, and it is on our website, and as you park your car, you're met with signs that we showed earlier that say you have to wear a mask. The only person that we've had who would not wear a mask, we explained to him that this is what our policy is and what we're following, and it's pointed out everywhere. This person was when they were upset with us, it turned out they were also an anti-vaxxer, so we got a whole earful of that other issue. But we treated him with kindness. We explained to him that, you know, wearing a mask was for so that we could continue to bring them the programs at King's Landing, so that we could continue to stay open, stay safe, have our visitors be safe, have our staff be safe. We ultimately decided to leave. We have had other people arrive without masks, not realizing that they wear a mask just because they happened to be driving by and decided to stop in. And we have non-surgical masks, the little blue ones that we provide for people, and many do take it. And we ask if they consider making a donation, and we set up a donation button, and are donating, and we're saying that that's going to people who have been adversely affected by COVID, people who have lost jobs. So we are going to be donating those monies to the COVID relief fund, and people have reacted in a very positive manner towards that.
Great, thank you, Mary. Chris, is there another question you'd like to pose to the panelists?
There was a question about students and volunteers, and I guess we kind of the panelists kind of touched upon this obliquely at various points. But are there any special considerations that you would recommend or that you would bring forward about how to handle volunteers and students who may be maybe coming to your sites? Is there special things you'd recommend?
Are you talking about summer students, like employment?
Yeah.
Okay, so we didn't let our volunteers, first off, we didn't let our volunteers back into our collection center up until I think maybe 10 days ago. And we treat our volunteers and our summer students as regular students, regular workers. So we put a protocol in place that goes through the supervisor or the person who's working with the volunteer, or the goes through, we have a green duotang, and go through every aspect of the GMB protocols for COVID-19. And we spend time, whether it takes an hour or a day, to go over everything. And at the end of the day, they have confidence that they're aware of the protocols. It starts either a volunteer or a worker here is issued a mask that they wear. And we've had no, because our operational plan is a living document, we ask people constantly. Like I said, draft 9 went out last week, and I've already got changes to make. As people work through it, they identify other areas, and we welcome all comments from volunteers, our staff, our casual staff, permanent staff, and the visitor, so that they see that we are making every effort to make sure that they are safe and everyone around them is safe.
Well, when I looked at your website, I was, and I saw your little COVID-19 section. So I looked there and it laid out everything. It was a really nice presentation of everything that that I could expect if I was going to visit the site. And so I thought it was really, really well articulated.
Thanks, Janet.
And it helped me with the presentation.
Interesting. Just one thing I'm noticing coming in the chat box from James Crawford. Is there a collections care concern about lower control of humidity and temperature and pollution dust due to greater ventilation of public spaces? That's interesting, because with the concerns around turning over the air and cleaning it through HEPA filters, what have you, is it going to cause problems for museums collections and other historic sites around, I guess, temperature controls, humidity controls? I don't know, Mary and Janet and Kendra, have you encountered anything in that vein?
Well, we have go ahead. We have the New Brunswick Collection Center, and that's a non-public spot, and that's really our buildings are not air conditioned. They're historic. There's over 60 buildings, so they don't have, we have windows open, and that's what they're used to, right? We're not having, the issue we're having with humidity is our staff is melting in the building at the moment. But we really, because we have the New Brunswick Collection Center, the lion's share of our collection is still in its perfect conditions at the moment, right? So.
Our major concern actually has been Taffel Music's instruments. So their Baroque instruments are stored on site in humidity controlled areas. And so we're having to seriously control how many and how much space in between people going into those humidity controlled areas, because those instruments really, we can't be opening windows and things. That's not going to happen. So there's been like a sign up for when you go into those spaces to take out instruments and how long it's been since the last person was in there. And
yeah, sorry, just to add on the ventilation element, there within the CCI task force, there is in the note, there is additional information on the ventilation question. And certainly, talking with the ASHRAE people, that would that would help between them and your facilities management. That would be a good way to go to have those discussions.
Great, thanks, Janet. There was a question, I think, about membership numbers and maybe visitation numbers and numbers of people coming to your sites and coming to Trinity St. Paul's. Kendra, if panelists could weigh in a bit on the impact and maybe how the government response measures are working or not working for your situations.
Yeah, so at the moment, about half of our user groups intend to return to Trinity St. Paul's. As I said, we're not in phase 3 yet, although Toronto had 5 cases yesterday. Woo, woo. So we expect to get to phase 3 soon. We certainly have struggled. So we've applied for CECRA for all of our residents, and their rent has been covered in that fashion. And we forgave rent for those who were not CECRA eligible. And then, of course, the wage subsidy has made a great difference to being able to keep all of our staff employed, which was important. So, you know, opening would be good. Money would be nice, but we're continuing on.
Well, in terms of King's Landing, as a Crown Corporation, there is not a funding, a COVID relief plan that we are qualified to apply for. There is nothing to address the issue of Crown corporations in terms of relief. So we are watching what's going on. Numbers in June were expectedly low. This past weekend, Saturday was a great day, but every bus tour we have has been canceled. Every school program is canceled till they figure out how we're going to go forward. You know, we are doing online education programs, which took off both in New Brunswick, but in other provinces and states, which was great. But at the end of the day, you know, at this moment, I wouldn't even say we have we're probably at the 40% mark. You know, we are less than half of our regular visitation. We are hoping that that's going to change, but we are looking at extending our season. We cut our opening from 7 days a week to 5 days a week, and that seems to be good. But you know, obviously, I'm watching to see what's going to happen, especially given that, you know, we don't qualify for any relief programs, and I might have to make some pretty difficult decisions come the end of this year.
I'm sure you and many other sites, Mary. So thank you so much for sharing your experience with us today. We'll wrap it up there. We've had a great hour. I want to really sincerely thank our 3 panelists, Mary Baruth from King's Landing, Janet from the Canadian Conservation Institute, and Kendra Fry from Trinity St. Paul's Centre for Faith, Justice and the Arts, and my colleagues Sonia Krutwagen here to talk about Historic Places Day, and Chris Weave. Really, thanks very much to everyone. Such an important topic, and we will, as I said, share within 4 hours the recording of this webinar with everyone who registered. And we can also include those links to Janet's document again and to Mary's opening plan if you're willing, Mary.
Yep, by all means, yep.
And just to note that we will be taking the month of August off from the gathering, so we won't be doing this for a few weeks, but we'll be back heritage leaders, people that are involved in the heritage sector to come together for these regular conversations. We're going monthly, so on the 3rd Tuesday of every month. Sometimes formal, sometimes informal, but very important to create regular opportunities for us to come together and talk about what's happening in the sector and how we can all come together and influence public policy and funding and government response to issues like COVID-19. So that the date of the next session is there on the screen. I really want to thank our sponsor for this session, Annapolis Investments in Rural Opportunity, and encourage you all to join us in September. Thank you very much.
Thanks, Natalie.
Thank you.
Thanks, everyone.